Just a few years ago, the world faced an unprecedented challenge with the COVID-19 pandemic, a crisis that changed how we think about health and safety. Now, there's a new virus making headlines, HMPV, or human metapneumovirus. While it may be the next COVID-19, it's catching attention for its rapid spread in China and its impact on children. In today's video, we'll break down everything you need to know about HMPV, what it is, how it compares to COVID-19, why it's causing concern in China, and what it could mean for the rest of the world. So grab a seat, stay tuned, and let's dive in. Let's start with the basics. What is HMPV? It might sound new to some of you, but it's been around for over 2 decades. First discovered in 2001, HMPV belongs to the same family as RSV, respiratory syncytial virus. Like RSV, HMPV primarily causes respiratory illnesses, especially in children and older adults. HMPV spreads through respiratory droplets, tiny particles released when an infected person talks, coughs, or sneezes. It can also linger on surfaces, making it easy to pick up if you touch something contaminated and then touch your face. Sound familiar? That's because it spreads in a similar way to COVID-19. Now, let's talk symptoms. HMPV feels like a bad cold or mild flu for most people. Common symptoms include coughing, runny nose, sore throat, fever, and fatigue. However, for young children, older adults, or anyone with a weakened immune system, it can lead to serious complications like pneumonia or bronchiolitis. And while most cases resolve on their own in a week, severe cases may require hospitalization. To truly understand HMPV, it's helpful to compare it to COVID-19. Let's talk differences first. COVID-19 and HMPV are caused by completely different families of viruses. COVID-19 comes from the coronavirus family, while HMPV is part of the paramyxovirus family. The severity is also different. COVID-19 was a global disruptor because it could cause severe illness in people of all ages, while HMPV mainly affects vulnerable groups like children and the elderly. Another key difference is transmission. COVID-19 was known for its limited symptom spread, meaning people could pass it on without even knowing they were infected. HMPV, on the other hand, spreads when symptoms are present, which makes it somewhat easier to track and control. But here's where the similarities come in. Both viruses thrive in similar conditions: crowded spaces, poor ventilation, and cold weather. They also put immense pressure on healthcare systems. Hospitals in China are currently seeing a surge of HMPV cases, especially in pediatric wards. Sound familiar? That's because it mirrors the early days of COVID-19 on a smaller scale. Now let's focus on the current situation in China. Over the past few months, there's been a sharp rise in HMPV cases, particularly among children. Hospitals in cities like Beijing, Shanghai, and Guangzhou are overwhelmed. Pediatric emergency rooms are packed, and many parents are struggling to get timely care for their kids. Here's what the numbers say. Between the 16th of December and the 22nd of December, 2024, HMPV accounted for 6.2% of all respiratory illness tests in China. That might sound small, but in a country with over 1.4 billion people, it translates to thousands of cases. During the same period, 5.4% of all hospitalizations for respiratory issues were linked to HMPV. The sheer volume of cases is putting a major strain on the healthcare system. So why is this happening now? One reason is seasonal factors. Winter is prime time for respiratory viruses. People spend more time indoors, where ventilation is poor, and viruses like HMPV spread easily. The colder, drier air also weakens the respiratory system's defenses, making it easier for viruses to take hold. Another factor is post-COVID behavioral changes. During the pandemic, mask wearing, social distancing, and lockdowns kept many viruses distant. But as restrictions eased, viruses like HMPV and RSV are returning with a vengeance, spreading among people who haven't been exposed in years and may have reduced immunity. So, why is the global community paying attention to a virus that's mainly affecting China? It all comes down to what we learned from COVID-19. After a global pandemic, every outbreak of a respiratory virus is scrutinized. People are asking, could this spread beyond China? Could it overwhelm healthcare systems in other countries? Here's the good news. HMPV is nowhere near as dangerous as COVID-19. It's not spreading globally, and it does pose the same level of threat. Also, its rapid rise in China serves as a reminder of how quickly viruses can strain healthcare systems if they're highly lethal. The HMPV surge in China offers some important lessons for all of us. First, it's a reminder that viruses don't take a break. Just because we've overcome COVID-19 doesn't mean other viruses won't emerge. Respiratory illnesses like HMPV, RSV, and the flu are constantly evolving, and they're not going anywhere. Second, it highlights the importance of being prepared. Early detection and response are critical to managing outbreaks. China's experience with HMPV shows how quickly healthcare systems can become overwhelmed, even by a virus that's not as severe as COVID-19. Finally, it's a lesson in staying informed without panicking. Not every virus is the next pandemic, but that doesn't mean we should ignore them. The goal is to stay vigilant, take reasonable precautions, and support public health efforts. That's a wrap for today's video. HMPV might not be the biggest threat right now, but it's a virus that's worth understanding, especially with its impact in China. It's a reminder of how interconnected our world is and how important it is to stay informed about global health developments. If you found this video helpful, don't forget to give it a thumbs up, subscribe to our channel, and hit the bell icon so you never miss an update. As always, thank you for watching, and we'll see you in the next one. Stay safe, stay healthy, and take care.